Hi guys, assalam warahmatullahi wabarakatuh. Welcome to Afros nursing. Okay, today it's my first video about nursing officers, and I'm in this channel. I'm going to do all about the things about nursing. What are the important things and about exams, notifications, other competitive exams. And about the subject also I'm going to teach in this channel, but at this time yes I see is a wonderful opportunity, and other competitive exams also we are going to understand about other competitive exams also. But ESIC is a trending now because only 60 days left for the examination. So here I'm simplifying it, so we don't have much time to revise all the things in our big books. Okay, so here in this video I'm going to let you know about what is about ESIC, and I'm also sharing about the how, where, marks, type of examinations, these all things I'm going to explain in this video, and about explaining about 100 most important topics we cover. Okay, I have chosen and selected some 100 important topics in from nursing also, and other than this I am going to solve these 100 topics in 60 days challenge. In this 60 days challenge I am going to take each topic about 25 MCQs for each topic. I'm going to explain in the further video, further upcoming videos. Okay, in these 60 days I'm going to complete all these 100 most important topics, and also golden topics, and also previous year's question papers and their explanation, and also cover aptitude test also, aptitude marks also I'm going to include in this playlist. Okay, I'm going to make it a playlist that it may be easier for you to understand in a sequential manner. Okay, let's get into the topic right now. Okay, here I'm going to explain about ESIC. ESIC is a Employee State Insurance Corporation. It is the exam conducted by the UPSC, Union Public Service Commission. Okay, the notification post name is nursing officers. So there are total 1930 vacancies are there. The application date has been closed by 27 March 2024. Okay, here the examination mode will be on CBT. Here it has mentioned CBT, but UPSC never goes for the online examinations. It will go for the offline only. So OMR is sure for ESIC. So it is a written examination. Obviously, the questions will be in an objective manner. That is a multiple choice questions. One question and four options will be given. In that we have to select the right one. And total marks for this exam is 125 marks. Total marks is 125, and total questions also 125. So each question carries 1 mark. Okay, the languages of the question paper is in Hindi and English. There is a negative marking of 0.25 marks. That means four wrong answers will take off one right question. Okay, right answer. 1 mark will be deducted for four wrong answers. Okay, the examination duration is 2 hours, and for the technical subject like nursing, they have given 100 questions, and for general aptitude and awareness, general aptitude and awareness is 25. So I'm mentioning here that in further videos I'm also sharing 2 or 4 classes based on the general aptitude and awareness. By that, at the end of the playlist I will upload it, because at the time of examination it will be near for us, because if we have studied in the starting only, we may forgot at that time. So we don't want to waste time, so that's why I will cover all these 100 topics, and then I'll go for the aptitude and awareness program. Okay, here document verification is simply after getting selected, after getting the final selection list of this examination, then direct selection will be takes place. So here how many vacancies there are? 1930 vacancies are there. In that unreserved is 892 vacancies, scheduled caste is 235 vacancies, scheduled tribe is 164, OBC 446, and EWS economically weaker section is 193. And these many vacancies are there. And what about eligibility criteria? The age should be must and below, must and should be between 18 and 30 years. Above 18 years and below 30 years should be there, and based on the category wise there is a age relaxation and exemption is there, and by that you can clarify that. And here you have to complete 4 years BSc nursing course, or otherwise if you have completed GNM nursing, general midwife nursing, you have to have 1 year experience in any hospital sector. Okay, the fee structure is for everyone is zero, and for only unreserved categories 100 rupees, that is for only male. Okay, and the female aspirants are zero. This is all about ESIC examination. What is the exam, how we have to prepare, and uh, how many from where the questions have been coming. So here I am going to explain 100 most important topics. Do not wait, I do not waste the time, I just enter into the topic. Okay, I hope you all guys understood about this. So here I have chosen some special topics for our preparation. Here I have given anesthesia and perioperative complications, trauma patients. These are all topics I am going to give. For each topic 25 MCQs. 25 MCQs. Okay, I am going to give 25 multiple choice questions for each topics in further coming videos. So hope you understand. By that you will cover around 3000 to 3500 topics. 500 MCQs, 3000 to 3500 MCQs for all over preparation. I hope that's enough to qualify, but you have to uh, sharpen your skills about such important topics. Okay, here anesthesia and perioperative complications, trauma patients, brain death, suture and anastomosis, sterilization and infection, blood transfusion, shock, transplantation, fluids, grafts, kidney, liver, heart, lung transplantations. Okay, and then from medical surgical nursing, I have divided into subcategories from neurology, ICP, intracranial pressure, seizure, gabapentin, phenytoin, sodium, clonazepam, tissue plasminogen, activated TPA, thrombolytic, stroke, multiple sclerosis, craniotomy, head injury, Parkinson's disease, carbidopa, levodopa, unconscious client, spinal cord injury, GBS, Guillain-Barré syndrome, MG, myasthenia gravis, TIA, transient ischemic attack. Medical surgical nursing, hematology, anemia and shock, leukemia, risk of infection, cross contamination, granulocytopenia, bone marrow aspiration and biopsy, Hodgkin's disease, multiple myeloma, rectal bleeding, vitamin B12 and iron, cephalosporin and bacitracin. Epoetin injections, thalassemia, jaundice, splenomegaly, hepatomegaly, hematocrit and HB levels, hematochromatosis, PRBCs, transfusion, polycythemia vera, protamine sulfate, heparin and prednisolone, systemic lupus erythematosus, thrombocytopenia, purpura, bleeding from superficial skin injury, plateless administration, splenectomy, and DIC. From respiratory, antihistamines, use of intranasal inhalers, nasal drops, and aortic infections, total laryngectomy, and larynx cancer, pneumonia, COPD, and asthma, use of MDI, metered dose inhaler, bronchodilators, pneumothorax, ARDS, chronic sinusitis, allergic rhinitis, nasal surgery and packaging, kyphosis and respiratory problem, TB, lobectomy, water cell test tube, tracheostomy, mechanical ventilation, okay, streptococcal throat infection. From cardiology, acute coronary syndrome, heart failure, MI, angina, valvular heart disease, peripheral vascular disease, Burger's disease, apostic disorders, thrombophlebitis, embolus formation, aneurysm, status ulcer, peripheral arterial disease, and hypertension, pacemaker, and CPR. From endocrine, Graves' disease, thyrotoxicosis, propylthiouracil. Graves' disease is treated with the, here most important one is radioactive iodine, which is been treated in the Graves' disease. Okay, saturated solution of potassium iodine, pituitary adenoma, Cushing syndrome or disease. Okay, hydromorphone, hydrochloride, diabetes mellitus, BMI, diabetic ketoacidosis, galactorrhea, hypoglycemia, transphenydoidal hypophyseectomy, Addison's disease, additional crisis, Addison's replacement therapy, bilateral adrenalectomy, perimenopausal syndrome, pheochromocytoma. Okay. From cardiology, acute coronary syndrome, heart failure, MI, angina, valvular heart disease, peripheral vascular disease, Burgers disease. Again, it is coming. Again, it is repeating. Sorry, dear. Sorry to one and all. From here, nasogastric, digestive nasogastric tube. Dysphagia, white patch on mucosa, stomatitis and appendicitis, oral candidiasis, gingivitis, oral cancer, PUD and GERD, subtotal gastrectomy, colostomy and ileostomy, lactulose, hernia, cimetidine and promethazine, metoclopramide, hydrochloride, it is also known as Reglan, okay. TPN, IBD, colitis, diverticulosis, paralytic ileus, cholecystitis, cholithotomy, pancreatitis, propanothalline, bromide, viral hepatitis, liver cirrhosis, encephalopathy, Singleton Blackmore tube, oral neomycin. From urinary system, cystectomy, ileal conduit, renal calculi, intravenous pyelogram, disequilibrium syndrome, ARF and CRF, cystitis, or and UTI, acute pyelonephritis, urinary incontinence, bladder cancer, peritoneal dialysis, hemodialysis, CAPD, urinary tract infection, phenazopyridine, hydrochloride, erectile dysfunction, TERP. Miscellaneous: latex allergy, nosocomial infection, anesthesia, cefazolin, midazolam, pulmonary emboli, autonomic dysreflexia, pulmonary emboli. Sorry, it has been mentioned two times. Okay. Autonomic dysreflexia, nerve injuries, neurogenic bladder emergencies, mass casualties, disasters. These are the most golden topics and important topics. These all are the important topics, very important topics, because from this at least one question is going to be asked. So ECG, ABG analysis, X-ray, CT scan, chemo, drug, CPP calculation, tumor marker, CRP, surgical checklist, drug of choice, fluid of choice, triage, fluid calculations, antidotes, therapeutic drug levels, instruments. Okay. From pediatrics, these are, I'm mentioning only the golden topics, which are the most important topics. From pediatrics, science of cardiology, immunization, recent immunization should be understood. Okay. Vital signs, newborns, Apgar score, phototherapy, low birth weight or preterm baby, growth and development. From growth and development, you should not go into the depth. You should only superficially go for um, growth and development of the children. So basically, I'll go for the MCQs. Cardiology. From cardiology, these 8 important topics are the most important: POA, TOF, ASD, VSD, TAP, VC, TGA, truncus arteriosus, coarctation of aorta. From OBG, from OBG, there are more and more topics are there. Here, contraceptives, EDD calculation, obstetrical score, instruments, drug contraindications and side effects. Other than this, you have to go for the labor, steps of labor, stages of labor, and the complications of labor, complications of pregnancy, disorders, placental abnormalities. About OBG is a major subject. From that vast syllabus is going to be asked in the examinations mostly. So I'm going to explain each and every topic here, and about postpartum hemorrhage, postpartum bleeding, so postpartum complications, about LSCS, so many things is going to be asked in the OBG. I have mentioned only the important, most important topics are there. Also the important. I'm going to do everything in this only. Everything I will cover every each and every topic in the OBG, from in these topics also, including with these topics. Okay. Fundamentals of nursing, biomedical waste management, scales, positions, drugs and fluids calculation, O2 therapy, equipments and devices, procedures, normal values. Okay. Hope you all understood about this. uh, so I'm going to clear cut here about everything. Means I'm taking, suppose I'm taking biomedical waste management in the next topic. From this, I'll collect 25 most important MCQs. By that you will cover almost all content in the MCQ itself. So by that you can sharpen your skills of multiple choice questions, how to answer the questions, and along with that you will get the content. So by that you can practice and prepare for the examination. It is my strategy, and I hope you will also enjoy this journey. Thank you so much guys for watching patiently, and if you have any doubts or any corrections in this video, please mention in the comment box. Your comment makes me that you are watching my video, and it's happy for me. Thank you guys, thank you one and all. Please do like, share, comment, and subscribe my channel. Don't forget to hit the bell icon. Thank you. Signing off, Afros Nursing.